Once you had breast reconstruction surgery, say it's not what you had in mind, do you have the choice to make a change? And then what would those choices be? Dr. Ned Snyder of Breast and Body Center of Austin is here to explain, and I guess what options does a woman have if it's not how she wanted it to
Sure.
turn out?
And a lot of, for just starting out, a lot of breast reconstructions are things that require maintenance anyway, that people may need future operations, just either whether it was an implant-based reconstruction or just the way that the reconstruction is aged, or maybe they never had a good outcome to start with. But all of those people have options. Sometimes that's a major surgery in terms of revising and maybe abandoning the old reconstruction and doing something new. And a lot of times, though, it's just something revisionary. It's maybe using a newer, better implant and reshaping the breast. Maybe that's just taking some fat that we might take like liposuction from one area and putting it in. Sometimes it's just completing that reconstruction, that somebody just never had a nipple reconstruction. Other things that may make them feel whole in the end. But
yeah, how long do you think, are there a lot of women that just live with it the way they don't want it for a while because they're afraid to it's a big deal to go get your body changed again? And so wouldn't you say to those people, come see me do it, don't live feeling bad about it, right?
Well, for one, just starting out, so many of these women, the year that they may have had mastectomies, may have had a reconstruction, may have had chemotherapy, they may have had a lot of things all happen at once. So it's an overwhelming time.
Totally.
And at the end product, if they're not happy, they may be tired, maybe just fatigued from medical treatment as a whole. And I think that as time goes on, they just sort of may become, just deal with it, just live with it, feel like that they can conceal things in clothes or whatever that may be. But they may never feel whole, may never feel the way that they did before, and I think those are things that we can impact.
Yeah, that you can help them with. So tell me about Bra Day coming up, October 18th.
So Bra Day stands for Breast Reconstruction Awareness Day. So it's this one day in the middle of Breast Cancer Awareness Month that we sort of recognize the importance of breast reconstruction as being a big component of breast cancer and treatment of breast cancer. So we have an event at our office, which is kind of fun in the afternoon, and a lot of it's we're honoring existing patients who we may only now see once a year that may come by the office, but it's also maybe a time when someone's thinking about choosing a doctor and choosing a surgeon, or maybe even without having to commit and make an appointment, but to familiarize themselves with the staff or the office or whatever that may be. We invite anybody to come by.
That's nice.
And they can find that information on our website, but that's on October 18th is the day. And
you've done more than 1,000 of the deep flap procedures.
That's right.
So you're so well versed in it, and this is a great time for us to ask our questions and get information from you, right?
That's right.
Awesome.
That's right.
Thanks for being here, doctor. We appreciate it. Snyder Plastic Surgery Breast and Body Center of Austin has locations in Austin and Round Rock. You can call 512-533-9900 or go to breastandbodycenterofaustin.com to schedule an appointment.